Hello, my name is Mary Louise Mattas. I'm a nurse practitioner student at Maryville University. This is my head-to-toe video, and this is my volunteer patient, Peyton.
Hi.
I have already done my general inspection on Peyton. I observed her as she entered the exam room. I watched her mobility and agility as she hopped up onto the examining room table. Before coming into the room, she changed into comfortable clothing. She is clean and neat, well kept. Her hair is clean and neat. She emptied her bladder, her vital signs were taken, her height and weight were taken, they were all within normal limits. Her distance vision was tested using the Snellen chart. Her near vision was tested using the Rosenbaum chart. Both of those tests test cranial nerve 2. I'm going to inspect her head and face, inspecting her skull and skin, looking at her eyes and ears for placement, looking for symmetry in the external characteristics. Cranial nerve 7 is going to be assessed. Can you clench your teeth real tight? All right. Can you wrinkle your forehead? Can you close your eyes real tight? All right. Can you stick out your tongue? Can you puff out your cheeks? Good. And can you show me your teeth and smile? Wonderful. All right, and now I'm going to palpate her scalp and her hair, looking for any lesions in her head, any lesions, lumps, bumps. Also in school-aged children, I like to look for any lice or nits, because that is common. All right, good. Now I'm going to palpate the facial bones and her maxillary sinus, ethmoid sinuses, temporal mandibular joint. Open your mouth. Close. Good. Then I'm going to test cranial nerve 5 with a cotton wisp. If you'll close your eyes, tell me when you feel.
Felt it? Yeah. Yeah.
Okay. And that's light touch sensation. Very good. Looking at her eyes, I'm going to inspect her eyes, her eyelids, her eyelashes, her conjunctiva, and her sclera, looking for any redness, swelling, drainage. And then I'm going to palpate her lacrimal apparatus. Just going to touch your eyes. Good. I'm going to test cranial nerves 3, 4, and 6, her pupillary response. I like to use my otoscope. I have it handy. It has a good light on it. You'll just look right at me. Direct and consensual. Direct and consensual. Then I'm going to test her fields of vision. First, we're going to do the cover test. If you'll cover one eye. Actually, first just look straight at me and then cover one eye. And uncover. Cover the other eye. And uncover. And that's looking for a strabismus. Next, we're going to cover the same eye. And I want you to tell me when you see my fingers come into your vision, just looking right into my eyes.
I can see it. I can see it. I can see it.
Great. And the other eye?
I can see it. I can see it. Yeah. Fingers.
Great. And that's testing her peripheral vision. Next, we're going to look at her extraocular movements using the 6 cardinal fields of gaze. So I want you to follow my finger, and only with your eyes, not moving your head. And convergence. And the last motion looks for lid lag. And I'm also going to check her inside her eyes, looking at the red reflex, and do a fundoscopic examination. With this, I use my right hand to examine her right eye. left hand, left eye. And the red reflex. And go on in. Next, I will examine her ears. First, I'll inspect her ears, looking at for symmetry and placement of her ears, palpate the auricles. And then I'll perform the whisper test. You'll plug one ear, repeat after me.
Horse. Fire truck. Ocean.
Plug the other, thank you.
Rainbow. Orange. Superstar.
Very good. And then the Weber and Renee test. I'm going to place this on your head, and if you'll tell me when you hear it, if you hear it in one ear, both ear, and if it's the same. Is it here?
Both ears.
Is it the same? Right. And then place it on the bone behind your ear. Then tell me when you stop hearing it.
Okay. Stop.
Again, tell me when it stops.
Stop.
Great. And then I would repeat that again on the other side. And air conduction should be 2 times greater than bone conduction. Next, I'm going to look in her ears to evaluate the tympanic membranes and the internal structures. Oh, my table moves. And her tympanic membrane is a nice pearly gray. And the ossicles are visualized within. As is that one. Next, her nose, inspecting her nose for alignment.
Ooh.
Going to look up her nose. Looking at her septum, the mucosa, and her turbinates. Her septum is midline, her mucosa is moist, and her turbinates are non-inflamed. You'll plug one nostril, please, and breathe. And the other. Great, and that demonstrates patency of her nostrils. Now I'm going to look inside of her mouth. Her lips are nice and moist, no dryness. Looking in her mouth, open wide. Mucomucosa is moist. I see no lesions. The oral floor, no lesions on her tongue. Hard and soft palate are intact. Uvula is mobile. Oral pharynx, open wide. She has a permanent lingual retainer. Her oral hygiene is She has great oral hygiene. Her teeth are nice and clean, pearly white. I'm going to say ah for me.
Ah.
And her her tonsillar pillars are 1+, and her uvula moves with the ah and
Wait, you didn't do it.
here, there.
You did that time.
Yes, I did. Sorry. Tested her gag reflex. And that tests cranial nerve 9 and 10 with the ah reflex and the gag reflex. Also swallowing tests that. And then if you'll stick your tongue out for me and move it to the side and to the other side, up and down. And that tests cranial nerve 12. And also with her oral hygiene, she has excellent oral hygiene. Teeth are clean, there is no mouth odor, which is excellent. Moving to her neck, inspecting of her neck, looking for symmetry, smoothness of her neck and thyroid, no jugular vein distension. And can you move her neck that way, the other way? Again, up and down, ear to shoulder,
This way.
and the other way. Okay, and I'm going to do it the same thing, back and forth, and up and down, and head over, okay, and now resist me. Push against my hand, push against my hand, and push against my hand, push against my hand. Good, and that's just testing range of motion and strength.
Hoorah.
Hoorah, you're stronger. And now, if you'll shrug your shoulders up, okay, and down, and now push. Great. And that shoulder shrug tests cranial nerve 9. Now I'm going to palpate. I'm going to palpate your carotid arteries. Your trachea. And the trachea is midline. The sternocleidomastoid is equal on both sides of my hand. Palpate your thyroid gland, looking for nodules. And then I'm going to palpate your glands, or your lymphs, sorry. Occipital, postauricular, preauricular, tonsillar, submandibular, submental, superficial cervical, posterior cervical, deep cervical, and supraclavicular. Now I'm going to auscultate the carotid and the thyroid with the bell of my stethoscope. Take a breath and hold it. And let it out. And another one. And release. And the thyroid. Release. Moving on to her upper extremities. Inspect and palpate the upper extremities, looking at symmetry, muscle mass, looking at her skin for any lesions, starting at the shoulder girdles, palpating down, palpating brachial pulses, palpating epitrochlear nodes, palpating temperature, palpating radial arteries, palpating down to her hands, noting the nails, looking for any clubbing or ridging of her nails. There are none. And then if you'll spin your back. Good. Thank you for the ponytail. Assessing her back and posterior chest, looking at her skin, at her thoracic configuration, and her respirations, inspecting. And then I'm going to palpate her spine. Palpate her costovertebral angle. Palpate for expansion. Take a breath. Good. And tactile fremitus. 99.
99. 99. 99. 99. 99.
Good. And now I'm going to percuss her costovertebral angle. And that should elicit a dull thud and not any pain. Now I'll percuss her lung ridges. Comparing both sides. And you're looking for resonance each time throughout the lung fields. Good. Now I'm going to look at our lateral first. Now I'll do diaphragmatic excursion. You'll sit with your hips square, your legs straight out for me. Thank you. percuss up. If you'll take a deep breath in and hold it. There's stillness. That's fun. And let it out. And take another deep breath. And blow it all the way out. And hold that. And there's the change. I'll measure that in centimeters. And that comes to 3.5. Now I will listen to your lungs. I'll auscultate the lung fields. Comparing each side, comparing right and left side. Good. Spin back around. Now I'll inspect her anterior chest. Starting again with the skin, looking at the skin on her chest, looking for symmetry, looking at her breathing, the respirations, seeing if there's any respiratory effort, any pulsations, any heaving. I'll palpate her chest. I'll palpate her precordium, looking for thrills, heaves, her pulsations. I'll palpate her left chest, looking for the apical impulse. Then I'm going to percuss. Well, first, actually, I'm going to do tactile fremitus. So 99,
99,
99,
99,
99,
99,
99.
99.
Good. And I'm going to palpate her axillary lymph nodes. And she's ticklish. Sorry. And then I'm going to press. Good. Now I will listen to her breath sounds and her heart tones. Now listening for her heart sounds or the aortic area. Pulmonic. Herb's point. Tricuspid. And mitral. Next, I'm going to examine her abdomen. If you'll lay down, please. First thing is to inspect the abdomen. I'll lift your shirt up. Is to inspect the abdomen for its overall contour and shape, looking for any motion or pulsations. Next, I'm going to auscultate the abdomen in all 4 quadrants. Then I'm going to listen for the arteries, aortic, renal, iliac, and femoral. And she's ticklish. Next, I'm going to percuss her abdomen for tone. Listening for tympany. Dullness over areas that have organs, tympany over gas. Now I'm going to percuss the liver border, starting at area of tympany, moving up to dullness. Again. There's the change. Now starting at the top, area of resonance. To dull. I'll measure that. That is 2 centimeters. Now I will percuss for splenic dullness over the left mid-axillary line. Now I will palpate her abdomen, starting with light palpation, looking for any tenderness, and I'm going to tickle her. Looking for any tenderness or masses, and then proceeding to deep palpation, again looking for any tenderness and masses. Palpate her organs, starting with her liver. Take a deep breath in. And her spleen, left kidney, right kidney, deep breath. Good. The aortic pulses. Just lateral to the umbilicus. And if you'll sit up a little bit, lift your head off the bed. There you go. Feeling those stomach musculature. And now moving the exam down to her legs, inspecting her legs, inspecting the skin, inspecting the hair distribution, inspecting for any lesions, any scars, any scrapes, abrasions, palpating for temperature, for edema, palpating the popliteal pulses. Also inspecting and palpating for muscle mass, palpating the posterior tibial pulse, and the dorsalis pedis pulse. As part of the neurologic exam, I've conducted or assess the cranial nerves throughout this examination. Now I'm going to do a sensation exam of sharp and dull. So if you will, tell me when you feel sharp or dull.
Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull. Dull. Sharp. Dull. Sharp. Sharp. Dull. Dull. Sharp.
Good. And now you can sit up. Spin around. Spin. We're going to test your reflexes. Brachial. Patellar. Achilles. And your muscle strength. Pull towards you. Away from me. Good. Push down. Good. Try to lift your legs off the table. Good. Good. Push against my hands. Good. Pull or push back. Yeah. Good. Excellent. And stand up. And earlier we tested her range of motion of her neck, her cervical spine, as well as the strength of the cervical spine. Now I'm going to test her back range of motion. Bend over. Also with school-age children, I like to look at her spine for evidence of curvature and scoliosis, looking at her hips, making sure her hips are even, and then looking at the curve in her spine, which is nice and straight. She has excellent flexion and bend back, then extension, and then side to side. Great, stand up on one foot, Romberg test, and the other foot. Excellent. And that concludes this head to toe examination. Thank you.
You're welcome.